Have you been doing a lot of sitting and zooming, and are you feeling kind of anxious and uptight, nervous maybe, and really locked up in your whole bottom of your body? If so, oh, please stop, get on the floor, grab a little towel or a strap and a pillow, and come with me as I help us all release all that tension in the lower body. Hips and psoas and thighs, these tend to just lock up with all that sitting and stressing. You are not going to believe how good you're going to feel in just a few minutes with me on the floor. In the beginning, I do give just a few seconds of introduction and sharing how you can best get the most out of this video. I'm Renee McLaughlin, a somatic movement educator, and I can't wait to share it with you. Are you ready? Set, get down on the floor, grab your towel, and join me. We're going to do this whole class, we're going to be on our backs. So just a couple of little notices before we start. This is going to be a class of just beautiful exploration, okay? It's going to be somatic, but it's going to be a little bit more flowy along with it. So even though we might be moving through it slightly faster with a flow, I'm going to really invite you to pay attention to your feeling, where you're feeling some tension, seeing if you can release the tension. If I go and I add some things, say upper body, and you're just not ready for that, you just go right back to your experience. Okay, so just really paying attention to the feeling and what's happening. So I'm just going to roll myself down here now. Let's just begin with the legs down and the arms down. It's always nice to just get a quick sense of where you're starting from, what you feel. Just notice like how your legs feel, especially one to the other. Think about how you're feeling with the body on the floor. In other words, like, is one side feel heavier? It would make a bigger indentation in the sand than the other side. Just notice if one foot feels like it's more flopped out to the side than the other one. Coming up, just noticing tush, because we're going to do a lot of releasing up in this whole area. So just get a sense of what it feels like left to right. And then rib cage, of course. Shoulders, how do your shoulders feel? Do they feel like one side's down more than the other? Do you feel open in the collarbones? And then it's nice to just bend your arms, bring them up like this, just notice. Again, I'm just going to say, and I'll try to keep cueing, you know, some of you might have some shoulder issues. So if I'm like stretching an arm up and it's too much for you, either put a pillow there or you just go to where it's comfortable for you. I like to take like one hip, slide it up towards the waist and stretch the other side. So just start to see how this feels to you. So I'm noticing even with my lower back that I definitely have some restriction kind of up lat area where that lat might contribute or kind of connect up to like T12 where the psoas is. And I've recognized that a lot of my pain when I'm dealing with is definitely psoas. I can feel it up in the front here, and then it goes along to the back. You might always have it like right in that top hip in the back, just noticing. Because as we know, even though there's pain in restriction in one area, it does not mean that that's where it's coming from. It's only where you're feeling the pain. All right, so then just allow your arms to be down, just relaxing in for just a second or two, one more time, getting a quick body scan and noticing. And we're going to begin right away. So go ahead and put your feet, bend your knees. I like to do a little lift and just drop down. You can just allow your shoulders to be there. Your arms might be at a low V if that feels good to you. Just complete neutral spine. Now, one way to really know if your legs are in a good place is you might want to just lift them up like that, knee right over the ankle, knee, ankle, and then just drop it. Same thing each side. And that'll give you a good understanding of, okay, that's where the legs should be. They're feeling good. Noticing if you completely relax here, what part of your back, like on the tailbone, is touching the ground? And maybe even rib cage.
So we're going to start with our arch and flatten. Okay, so go ahead. You can even, it's nice in the beginning to put your hands on those lower bellies because it just feels soothing. And just notice, it'll also give the brain a place to go to. I want you to just notice if you're holding any tension in that belly. Like I'm just going to even shake it a little bit, just to relax those belly muscles. And let's go ahead right into the arch. Inhale. Belly inhales, big belly lift. Allow the tailbone to roll down. I'm going to let my hands go down now. Just feel that big arch in the back. Notice the chin will tuck. Your shoulders may roll away down towards the floor. Allow it to happen. And then just slowly let it come back. And I'm going to go right into the flat back. So now your rib cage draws in. Tail will tilt just up a little bit. Your chin may lift and the shoulders may go in. So let's just do this your tempo, inhaling and arching. Allow the rest of the body to respond. Notice what you're feeling today. Exhale. And go right into, you almost pass neutral. And then just allowing that lower back to press. Tail lifts a little bit. Good. Let's go again. Inhale, arch. Now on this arch, pay attention now to the inhale and the flaring and the opening of the rib cage, getting that big deep breath. And then exhale. Notice how the rib cage draws together and down towards the pelvis as the pelvis lifts slightly. Belly button draws in. Let's just do 2 more of those. Inhale, arch. Drawing it down. I'm rolling so that my shoulders are down towards the ground. My chin is tucked. So you're really engaging all the muscles of the back. And then exhale. Let it come back. Rib cage draws together and in. Shoulders might roll in towards the pecs and the chin lifts. So just explore it a few more times. Inhale, arch. Oh, see how big you can get those ribs. Exhale. Good. One more time. Notice, especially as you go to inhale and arch, relax the lower belly muscles. And exhale. Right into the flatten. Nice work. And then just come to neutral. And you might need to adjust the head, lifting, maybe doing a little wiggle to side, and relax now into this position. So we're going to go right into now doing that, and we're going to release the psoas. Okay, so I think most of us know what the psoas muscles are. Those are like those hip flexors that start up here into the leg and go all the way to the back spine. And that's those sitting muscles when we're sitting too much, right? And so we're going to be releasing them. So here's what you want to do. Go ahead and inhale, arch. Really arch it. Exhale, and on the flatten, take your right leg, flattening the back, and just lift the knee in. Feel the lengthening now of that spine. And inhale, just drop it down again and arch. Good. You can allow the rest of the body to go with you. Exhale, flatten and lift that knee in. Notice what you might be feeling. Inhale one more time, arch. Really let the tail roll down. Exhale, the shoulders can roll in, the chin might lift, lifting the knee, feeling it. Let's do it one more time. Inhale, arch. This time, exhale, flatten, lift the knee, and you might even want to gently press your left heel in the ground to bring it in even more. Notice you might just get more sensation. And then just allow that leg to come back and come to neutral again. And just completely relax everything. Good. Now we're going to add on to this one. So one more time, we're going to inhale and arch. letting that tail roll down. Exhale, flatten, lifting the knee up. Good. And then just drop the knee to here. Inhale, arch. And this time, just slide that foot all the way down so the leg becomes straight. Good. And just relax everything. Now, inhale, arch. Allow that leg to lengthen. Doesn't that feel good? You're really stretching out in that psoas. Okay. Exhale, flatten. But allow the leg to just relax. So what you're feeling now, the muscles that are working now are just core. Okay, so let's just do that again. Inhale, arch. So relax the leg. Notice how the leg draws down on that arch. You're probably getting a nice lengthening on the front of the leg. And then exhale, flatten. Good. Come to neutral. Let the knee bend back up again. Now, you can either do that again, or when you lengthen, you can also bring the arm straight up. Okay, so either way, inhale, arch. Exhale, flatten, straighten the leg, and bring the arm all the way up. Good. So now in this position, arch, inhale, arch. So lengthening from the leg, the arm lengthened, you'll feel the shoulder. And now when you flatten, relax the leg and the arm. So you might feel the top of the shoulder there, maybe the top here, but the arm and the leg are relaxed. Let's just do one more inhale, arch here. Inhale, arch. Notice the arm stretches. You'll feel rib cage. You'll feel it down there. And then exhale. Good. And go right to the flatten, but the arm and the leg are relaxed. Good work. And then just come to neutral and bend that leg and bring the arm straight down at your back and do a bit of a wiggle. Now, let's go ahead, straighten that leg, straighten the other leg. And just with some of those little somatic movements, notice if you feel a little bit more open there on that leg or that whole side. Completely relax all your muscles there. And just notice. Just give me a little thumbs up. You don't have to move from there if you feel a little difference on that side. Okay, thank you. All right, beautiful. So now let's do the other side. Go ahead and bend both legs. And I left my left because my left was my more challenging side. Yours might not be, it might be the other way, but either way. So let's go ahead. Here we go. We're going to inhale, arch. Allow that tailbone to go down. You can roll the shoulders out, let the upper body just respond. Exhale, flatten, and now lift the left knee in. Feeling that lower back lengthen with that. Good. And then bring the leg back down. Inhale, arch again. Feel the ribs expand, the shoulders roll down. Exhale, flatten. Lifting the knee, lengthening through. Good. And then bring it back down. If you want this next time, you can add the pressing of the left heel. So inhale, arch. Relax that belly, let those ribs open. Exhale, ribs close, draw down, leg lifts. Then maybe think about the left heel, gently press it in the ground and notice how you get maybe even a little bit more engagement in the top of that psoas. And then slowly allow that to drop. And let's come to neutral for a minute and completely relax all these muscles. Good. Let's do that one more time. Inhale, arch. You might find that you're really able to arch even more now because you've relaxed so much. Exhale, flatten, press, lift the knee. You can gently press the heel and then bring it back. We're going to inhale, arch. And now, as you go to flatten, let that leg straighten out to the bottom. Good. And then just completely relax. So just relax in this position now. Inhale, arch. And allow that left leg to just lengthen on its own as you arch. Exhale, flatten. Good. Notice what you're feeling now with that leg long. Inhale, arch again. Inhale, arch. Allowing the leg to lengthen. Tailbone draws down, your chin is down, your shoulders might be down into the ground. Exhale. You'll come to neutral and then flatten. Beautiful. Come back to neutral. Bend that knee back in again. Good. Now we're going to add the arm lifting at the same time that we do that. Let's bring the leg up first though. So inhale, arch. Exhale, flatten and bring the knee in. Just because that feels good to me. Good. Then as you drop, you'll come to neutral. Inhale, arch and stretch the leg up and the arm up. Ooh, so good. And then exhale, flatten, pressing the lower back. And letting the leg lengthen and the arm lengthen. And then just come to neutral there. Good. Let's inhale, arch. I always think that arch with that long leg just feels so good because you're just lengthening and the arm will automatically reach up. And now on the flatten, relax the leg and the arm. But you're going to feel that lower back pressing and even the top of the shoulder pressing. Let's just do it one more time. Inhale, arch. Feel that tailbone rolling down, lengthening up on the top of that psoas and the shoulder. And exhale to flatten, relaxing the leg, relaxing the arm, feeling the back flatten down. Then come to complete neutral. Just relax there for a second. Notice what everything feels like. And then let's bring the arm down and just bend that leg and relax there. Nice. Let's do a little rock. Just bring the knees in and just give yourself a little rock. Notice what that feels like now. Hopefully you've gotten a little bit of release there. Beautiful. All right, we're going to add on to some more movement. Doesn't that feel good? Dropping the legs. Now, if you have your towel there, you might want to grab it or your strap. Again, I'm starting all these movements. I'm doing everything on my right side, and then I'm going to switch and we'll do everything on the left. Now, I'm doing it that way because my left is my more challenging side. You want to end on your more challenging side. So if you find your right side to be more challenging, like in that hip, and I want you to, when I say challenging, hip, inner thigh, outer thigh, glute, we're going to work all of this. So start on the one that's least challenging, okay? I'm going to call it off on my right because that's my challenging side. So I just wanted to mention that. All right, so let's begin with, you're going to bend this leg, I'll call it my right. Put your towel right here, not right behind the knee, but right there. Good, and just allow your lower leg to relax there. Ideally, you want the knee right over the hip. And just have your hands here. This is so nice because you don't have to grip them and have any tension in the upper body. So from here, just start to straighten that leg. Now notice that especially as you get up straight, you're going to feel the quad engage, maybe even the hamstrings, you'll feel them against the towel. So here you go, you're just going to lengthen to wherever you can. You may not be able to get it all the way straight, it doesn't matter. And then slowly release that leg down. The lower leg, I should say. You're holding the upper leg. Slow, there's your pandiculation. Slow release. At the bottom, just relax. And check that you're not bringing that knee in too close to the torso. I realized I was doing that. So let's do it again. Slowly straightening that leg out. Good, feeling the contraction. And then slowly releasing it back down. I notice as I start to bring it back down, I shake. So that's just telling me I've lost some control over it right at that point. So interesting. And relax it at the bottom. We're going to bring it up again. Slowly bring it up, feeling the contraction. And once you're up just to wherever it's comfortable for you, again, if your knee needs to bend, we're not going to worry about that right now. There you are, you're just up there. Now we're just going to start working lower legs. So all I want you to do, you're looking up. See if you can press just your toes back towards your torso. So you're pressing your toes in towards your face. That might be a better way of looking at it. Yes. Notice where do you feel the contraction there, and then just release those. Good. Now let's flex the foot. So you can either think about toes towards your face or reach through the heel. Ooh, that's challenging. And then relax it. Let's do that again. Start to flex the foot, reach through the heel. Where are you feeling that lower leg? And then just you can do some ankle rotations. So as you're doing the ankle rotations, you're trying not to let the whole leg move, right? You're holding it there with your towel and take it the other way. See if you can feel what you're feeling. You can even see the calves. The calf kind of tighten and release, and then just relax the leg there. You might even want to relax the towel for a second. If your hands are holding, relax in the hands. Now, I'm going to you can either use your hands if you don't have a towel, or you can use the towel. So with the towel, what we're going to be doing is rotating the thigh bone, the whole leg thigh bone in the socket. So you can take the outside of the towel and press it in to allow that thigh bone to rotate internally, and then use the other side, pull it in. So just use your towel to rotate the full thigh bone. Notice what you're feeling. So the hips aren't moving. The lower leg is just going along for the ride. Getting some good rotation just to wherever you can, right? Some of us don't have a lot, but this is a great way to start to get some good movement in the thigh. Now I'm going to externally rotate it so that my knee is facing outside to the side of my body. And then I'm going to slowly, look at me shake, slowly bend the leg down like you just did. But this time we're doing it from an external rotation. And slowly straighten the leg back out and up. I'm going to do it one more time because I am so shaking. Notice what you might be feeling in there if you're shaking, and relax it at the bottom. Nice. And let's just bring it all the way back up again. And then rotate that whole leg internally, right? So now your toes are facing more the center of your body, same as the knee. And then say, woo, just shaking away. That's so interesting. And take it all the way down and bring it back up again. So we'll just do that one more time. And slowly release it down. So we're just doing some nice quad and hamstring panticulations, but from this standpoint. And bring it back up again. Nice. Now rotate that leg again so the knee is straight ahead. You can drop that towel, holding on. Just let the knee bend and relax there. And you can use your hands if you want, maybe hand on a knee, or just let the leg go. You're just going to be drawing some big circles with that thigh in the hip. So feel free to use the hand to support it. You're going to take it down. Just getting some slow circles on that hip, opening it up before we go to our next level here. The same side. So just feel what you're feeling. If there's some restriction in there, just take a notice. Good. And now take that leg and cross it over the other and just allow it to be. So obviously we've done the number 4 stretch. We're going to do it a little bit with a little different focus today, okay? So I want you to notice that the hips are level, That leg is there. It's relaxed, okay? So when you do this, really notice what you're feeling. So from here, allow the knee to draw in a little bit towards your face. And with your hand on the knee, gently relax in that hip and start to, in a relaxed position, start to just use your hand to press that knee away. Just pay attention to where it starts to hit. If there's tension, see if you can use your mind to relax it. So just take it out a little bit and then let it relax and release in. Let's do it again. With your hand, you're gently pressing it out. And bring it in. Notice when you bring it in, you might feel inner thigh tension, tension in the hip joint. Now I'm going to do it. Try now to do it without the hand. If you need the hand, bring it back. But see if you can start to use some muscle to press it out a little bit till you start to feel it engage. And then let it just relax back. Notice now you might be getting a little bit more motion out of it. Taking it out, pressing it away, and just allow it to come back. You're not pressing it back, it's just pressing. Now, let's get a little bit more sensation. So to do that, flex that foot. So you're pulling those toes back towards your knee. And now with that flex, go ahead and let that knee draw away. Keeping the mind in there, notice what you're feeling. Like right about there, I start to feel it. Where are you feeling it? In the outside hip. And then just relax it. Let it come back in. Let's just go again one more time. Taking it out. And then just letting it come back in. Good work. All right, now take your hand on the outside, the opposite hand on that knee, opposite hand, and just start to bring that knee in towards the opposite shoulder. Now, you're going to feel the inner thigh engage and then the outer thigh. So you're just going to use your hand to support. So I'm going diagonal with that leg. And then just allow it to drop back. Good. I'm going to bring my foot in a little bit more, taking that hand again, or you can bring it in a little bit till you need to, and go slowly, bringing it in. Are you also now starting to feel the engagement of the IT band, inner thigh? So you're contracting it in, and then slowly letting it just drop out and relax. Let's go just one more time. I'm going to bring it in myself because I don't want to really feel a lot of engagement in my upper back. So I'm just going to bring it in a little bit till I can kind of grab it. Relax, relax, relax. As you bring it in, there's your nice hug. And then just allow it to drop back and relax. Now, just stay relaxed here. We're going to do an arch and flatten in this position. Okay, so here we go. I want you to inhale, relaxing that belly. Inhale into the belly. Draw the tailbone down. I'm going to bring my arms out and allow those shoulders to roll out, chin tuck, so I get even more upper back. And then exhale, flatten. I'm going to bring my shoulders in and let the chin lift. So let's just, again, inhale, arch. Good. If you want, it feels good. You can take that knee that's on there and press it away just a little bit. What are you feeling? And then slowly come back and go right into your flatten. Let's just go one more time. Inhale, arch. And exhale, flatten. Nice work. And then just come to a neutral. Now, we did a lot of that in and out. Let's just do one last thing on this side before we go to the other side. Uncross that leg now and bring the feet out a little bit wider than your hips. Okay, so wider hips. Now you're going to let the left knee stay where it is. You're going to inhale and allow this right knee. It's going to drop to the inside, but it's not just direct over. I want you to think about that knee dropping over towards the opposite foot, right? So it's almost like at a diagonal. Try not to let the left knee lift. So as you're rolling to the inside big toe ball joint of that foot, allow that lower back to lift a little bit. Feel the stretch on the top of the hip. And then slowly bring yourself all the way back. Good. Let's do it again. Inhale, dropping the knee down, diagonal. Relax the whole rest of the upper body. Your head will probably want to look over to that side. Allow the upper body to move with the movement. And all the way back. Good. And relax. Now, if you want, you can just keep doing that. But you might also this time, as you drop the knee down, inhale, arch, you might want to bring that arm, same side arm up. Looking that way. And feel that whole side lengthen. And then allow that arm to draw down, maybe even just to your shoulder, and bring the leg back. Let's go just one more time. Inhale, arch, letting that knee draw down. The chin will probably draw down. That arm reaches up. So you're getting that big stretch there. And slowly bring it all back. Good work, you guys. Bring the feet back in. Hip width apart. And just allow the legs to draw down and completely relax. So now we've done a lot more work over in that whole hip area. Again, notice, does that side feel more open now than the other side? How are you feeling there? Thanks, Suze, for that feedback. Appreciate that. And just relax everything. Taking a minute in between to really notice is not just a light little thing. It's really allowing the body to completely reset, lengthening those muscles. It's like resetting the GPS in your body. So it really is important to take a second or two to allow it all to process and for the brain to process that one side. All right, so here we go. We're going to go to the other side. Bend both knees. Let's do a quick rock. I always like to keep doing the quick rock, just to keep that lower back and the hip, noticing what you're feeling. You're doing a little circle rock there, always nice. Hopefully you're feeling really good in there. And then let's drop those legs hip width apart and grab your towel. And we're going to start with that whole big long flow on that other side. So lifting the knee so it's right in line with the hip. Pulling your towel in, relaxing your shoulders, your hands are just there holding the towel for support. And now allow the lower leg, it's completely relaxed. The other side is relaxed. The right side is just supporting you. And you're going to slowly start to lift the lower leg. You'll find a place where it might shake, mine is. As you straighten up, you'll feel the quad engage and the front of the leg and the hamstring. So just feel that and then slowly release. So the hug, the contracting the muscles is when you're all the way up there. Here's your slow release and that pendiculation. And with the bottom, just relax. Even relax that tailbone. And let's go again, straightening it up. Good, there's your hug the muscles, feel the engagement of all the back of the leg muscles, hamstrings and quads, and slowly release down. Noticing if they're shaking. Shaking just shows that the brain has lost control over those muscles at that moment. And release. Let's go up and we'll hold at the top here. So again, a slow lift. Even if your knee is still bent a little bit, it's fine. You don't have to overdo anything. And then once you're comfortable there, you can relax the hands a bit. The leg is just holding you there. And just as you're looking up, see if you can pull just your toes towards your face and spread them. Boy, that's such a brain exercise, isn't it? Looking at those toes, trying to make them work. Nice. And then release the toes. And then flexing the foot. Ooh. You can even bend that knee to bring that in just a little bit towards the body and then straighten and stretch through the heel. Oh man, that's intense. For me anyway, I really feel that in the lower leg, and then just relax it and give yourself some nice rotations there. Ankle rotations, flexing the foot, rotating it around, and then the other way. Noticing, I'm looking at that and I'm watching my calf muscle engage and disengage. It's kind of a fun thing to do. All right, so now we're going to be rotating the thigh bone in the hip. Again, feel free to use the towel so you can take the inside and pull it in to allow an external rotation of the thigh bone and the other way. And just notice, relax in the socket. Notice if it feels like you have more or less movement of the thigh bone in this side than you did on the other side. Like I can barely internally rotate this leg. I see where I'm really holding some restriction in there. All right, so now I'm going to externally rotate that leg. So my knee is facing to the outside, holding it up there with that leg, with the towel. Slowly start to bend the lower leg in that position and straighten it back up. Good, so now we're working to do a pandiculation in that particular movement with that external rotation, and slowly bring it back up. And then use your towel or your hands to rotate the whole thigh bone internally. Knee is looking more to the inside, and go from there. And straighten it back up. So again, notice the shaking. Boy, I'm shaking. And I know that's the side that I'm having some other issues in. So it's just letting me know that yes, indeed, I'm holding tension in that hip and thigh, and bring it back out again and up. Good work, you guys. And then bring that knee back to center. You can drop the lower leg. You can release your towel and either use your hand, or if you don't need to use the hand, but the hand feels really supportive, just start to allow yourself to have that hip start just doing some hip circles. Feel what that feels like. You're just noticing what you're feeling as you move that leg around in the hip. So as you internally rotate, you're feeling a lot of, inner thigh muscle, outer thigh muscle. It's kind of nice to keep your hand there and just notice that. Super good. All right, so now from here, let's go ahead and put that leg up on the other leg. And you can just kind of relax here for a second, relaxing it out. Make sure now that the right leg is under your hips, because that's your stabilizer. Flat foot, just notice that that foot is flat. You're not like rolled out or rolled in, flat foot. Relax here. And I'm going to put my hand gently on that knee, and I'm going to bring that leg, I'm going to start to press it away just a little bit till you start to feel the contraction. Again, we're not trying to get into any pain here. And then just release it and let it just come back to a neutral place. And then again, you can use the hand to press it away. Notice if there's a place there that all of a sudden you find your muscle just automatically tightens. See if you can relax it there, and then just let that knee come back. Good. So this is where it really takes so much mindfulness, right? Because especially in those hips where we know we're going to be tight and in pain is where we tend to automatically contract. So now we're really asking the body to relax it. You're supporting it so it's safe. See if now you can just do it without the hand. And if it's not comfortable, it doesn't feel safe, pull the hand back in for support, pressing it away, and then just allowing it to come forward and releasing. Good. Now I'm going to start to draw this knee in towards my torso a little bit so I can grab with my opposite arm, and I'm going to slowly bring that knee to my opposite shoulder. So now what are we feeling? We're feeling that internal inner thigh contract and the outside or that IT band to work. And then just allow it to drop all the way back and relax it. Good. Bringing it in, grabbing with the other arm. Bringing it into the center again. Notice where it starts to grab and you're like, ooh, right there, I feel it. Back off a little bit. This is another really good one for releasing in the piriformis or in the butt muscles and in that IT band. And release back and relax. Now I'm going to do it without my hand. Just see where I'm at here. Bringing it in and releasing it out. Good. Now I might flex this foot. I kind of probably should have done that before, but so what? We're going to flex the foot. So you're going to feel more. So if you flex the foot right off, notice how you get more sensation. And then you can press that leg away with a flexed foot. Do you feel it a little more? See if you can just stay really relaxed. And then just let it release. Good work. Now, let's go ahead, relax the foot, relax the leg. Inhale, arch. So now you're arching. Again, I like to kind of really let my hands rotate out, my chin tucks, so you can really feel all the back muscles engage. And then exhale, let the rib cage come together and press the lower back. So let's inhale and arch in this position. Rib cage expands. Feel the whole back of the body. Exhale. Good. And then bring it back to neutral. You know, the next thing you can do is inhale, arch. Exhale, flatten. And if you want, you can even lift that lower leg. Go really gently. Notice when you start to feel it in that IT band even more. You're really using your abs as well. Drop the leg. Inhale, arch. Exhale, flatten. And if you want, you can gently lift. If this is too much for you, don't. Just arch and flatten. See if on each one you can bring it in a little bit more. And then bring it right back to neutral. Good. Uncross that leg. Beautiful. And now bring the legs out a little bit wider than your hips. Good. And now we're going to do that internal. So that was a nice external rotation of that leg as we did that. We did bring it in and up, but now we're going to work on that internal rotation of that thigh bone. So now keeping the right leg up, you're going to take the left leg. You can inhale, arch, drop it into the center and down, almost like a down diagonal, down almost towards that right foot, and feel that internal rotation on that leg and that nice hip stretch. And then slowly allow it to come back. Good work. Relax there. Inhale, arch and drop it. Leg lengthening it out. Try to keep the right one up. I noticed mine was wanting to open. And exhale, flatten and bring it back. And if that's enough for you, you can just stay there. If you want, you can also lengthen that opposite arm and bring it up. Inhale, arch, letting that leg drop down. Same side arm lifts. You can press the inside, that big toe ball joint side of that foot in a little bit to get even more length. And release it all the way back. I'm just going to relax my arm there. Let everything go. I'm going to go just one more time. Inhale and arch, dropping it in, letting that opposite arm lift. And all the way back. Bring that arm down, the leg open. Good work. Bring the knees in. Come on up for another final rock. Nice little rock there. Beautiful work, you guys. All right, and now from here, just allow yourself to roll over onto one side into a fetal position. Just let yourself settle in a fetal position. Relax everything. Just let yourself completely relax here. Nice. And when you're ready, I'm going to push myself up. I'm personally feeling like it would feel really nice to go into a bit of a child's pose. You can stay there if that feels good, okay? Or I'm going to go into a bit of a child's pose. I'm going to have my knees out a little bit. I'm going to allow my forehead to be on a pillow, relax, my chin tucked and my arms down. This for me feels really good for my whole back and nervous system. And you can just allow yourself to stay either fetal or here if this feels good. And just let everything settle because you did a lot of work in your nervous system as well. Notice what you're feeling, regardless of where you are in that whole lower back and hip region. And when you're ready, you can slowly allow yourself to come up. I would stop in a nice position to just kind of bring yourself back into your body a little bit or out of your body or whatever feels good. I'm just going to do a little bit of rotation here. And I hope that that felt really good for you. Be really gentle with yourself as you get up to make yourself come back into your day. Because that was a lot of work. You don't want to just jump up and get into something else that you're doing because that was, a lot. So I'm just kind of doing some hip circles, some shoulder work.